The following program contains mature subject matter. Viewer discretion is advised.
Welcome, everyone. We're going to jump right into some hot headlines. And join us today, OB-GYN and friend of the show, Dr. Aliabadi.
Welcome back.
Thank you. Thank you for having me.
Glad you're here for this because the question we're posing today is, could a common procedure used to treat precancerous changes of the cervix by scraping away abnormal cells, could it destroy a woman's sex life? That's what a number of women are claiming in the U.S. as well as abroad. Our first guest, Rhonda, has had this procedure. She says she has suffered ever since. She joins us via Skype along with Dr. Irwin Goldstein, a urologist and founding editor of the Journal of Sexual Medicine. So, Rhonda, can you explain to us why you had this procedure and then what happened to you afterward?
Yes, in 2017, I was diagnosed with SIN3, or stage 0 cancer. And I was told that if I didn't have the LEAP procedure done, that it would turn into cancer pretty quickly. And after that, I noticed a loss of sensation in many areas of my life, including sexual.
And just to help educate folks, Dr. Aliabadi, can you explain what this procedure is we're discussing?
So it's called the LEAP procedure. It's an outpatient procedure. And what we do, we remove the precancerous cells that sit on the surface of the cervix. The cervix is the mouth and the opening to the uterus. So on the superficial part of the cervix, that's where these precancerous cells live. And we just scrape them off in a very simple office procedure, and we get rid of those precancer cells. It's usually done in patients with high-grade lesions, meaning between normal and cervical cancer, there are 3 stages of precancer. We use this procedure for patients with high-grade precancer cells, which is level 2 and 3.
If you're scraping the cervix, per se, the nerve endings that are going to come into play with sex are not there, but other parts of the vulva, the vagina, the external genitalia. So I'm not quite seeing the connection there.
Well, Dr. Goldstein, I think this is a perfect time to bring you into the conversation because I understand this is an area of research for you in terms of how this procedure may impact sex life, correct?
That is a correct statement. And the cervix is a sexual organ. It's involved in orgasm in a percentage of women. The clitoris is an organ that causes orgasm, the vagina, and also the cervix. So in some women, if the LEAP happens too deep, it can take away their genital brain connection. And essentially that's what happened to Rhonda, sadly.
Well,
so Rhonda, can you describe a little bit your experience? Have you experienced this kind of sequela from your procedure?
Yes, I've lost a large amount of vaginal stimulation, even clitoral, and I've even lost stimulation in my life. Everything seems dull.
We're so sorry you're going through this. I understand that you do have an online support community that helps you with this as well, correct?
Yes, that's correct. It's a Facebook group called Healing from LEAP, and we have well over 600 members, all women, all have been through this procedure, all have long-term side effects.
I've been practicing for many years. I've done thousands of these procedures. To this day, I've never had a single patient come back to me, not a single patient come back to me and complain of sexual dysfunction. If the procedure is done right, you will not have any sexual dysfunction. You have to remember, we're talking about precancer cells. A CIN3, you can look at it as a high-grade precancer cell that it's almost a cancer that hasn't spread. So it's not something you can ignore. You need to do the procedure. I always say you need to be alive to have sex, right?
Is it possible that in the wrong hands, this procedure could be damaging?
Yes, I have walked into surgery operating rooms and I've seen the specimen on the table in a 22-year-old that I almost passed out. And I thought the patient had cervical cancer because to me, her entire cervix was on that table. I remember that day walking out thinking to myself, what I was thinking was not the sexual dysfunction. What I was thinking is cervical incompetence in pregnancy because you need your cervix to hold the baby in. And when you chop off the cervix, then at 18 weeks of pregnancy, well, the cervix, whatever's left of it, opens up and the baby comes through.